Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on amoxicillin, the antibiotic. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing to discuss in this presentation is what amoxicillin is used for. So amoxicillin, the antibiotic, treats infections or stomach ulcers. This medication is a penicillin antibiotic. We'll now discuss how to use amoxicillin. So first off, your doctor will tell you how much medication to use. Do not use more than directed. If you're using the chewable tablet, you must chew the tablet before you swallow it. You may crush the tablet and mix the medication with a small amount of food to make it easier to swallow. If you're using the oral liquid, shake well before each use. If you choose to mix the liquid with another drink, be sure that your child drinks it right away. Take all of the medication in your prescription to clear up the infection, even if you feel better after the first few doses. Now what happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, skip the missed dose and take the regular dose. Do not take extra medication to make up for a missed dose. We'll now discuss some warnings. So tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, allergies, or a condition known as PKU. Tell your doctor if you are on dialysis. This medication may cause diarrhea. Call your doctor if the diarrhea becomes severe, if it does not stop, or if it is bloody. Do not take medication to stop the diarrhea until you have talked to your doctor. Diarrhea can occur up to 2 months after stopping amoxicillin. Tell your doctor or dentist who is treating you that you are using amoxicillin because this medication may affect certain medical test results. Call your doctor if your symptoms do not improve or if they become worse. And use this medication only for the infection that your doctor has prescribed it for. We'll now discuss some adverse reactions or side effects. So if you experience any of these, you would want to get in touch with your physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, if you had blistering, peeling, or a red skin rash, or diarrhea that may contain blood, with stomach cramps and a fever. For the following side effects here, you would just want to let your physician know at your next appointment, or even talk to your pharmacist about them next time you pick up a prescription. So if you had mild diarrhea, nausea, and vomiting, or a mild skin rash. Alright everybody, that's all we're going to talk about today with amoxicillin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description that you can check out as well. So for today, take care.